Yeah. The Mwakazis. Thank you for joining the stream, family. I appreciate you. Thank you for waiting. I've just been waiting for the family to come in, and I appreciate you coming through. Thank you for subscribing as well. I might as well subscribe. All right, I might as well subscribe to your channel. So I really appreciate it. All right, really appreciate it. So yeah, welcome to my channel. I am Chief Drino. My channel is all about Pan-Africanism, the global unification of everyone of African descent. Okay, wherever you find yourself in the world, if you recognize that you are of African descent, okay, link up, okay, unite, and let us go build Africa, okay, and make it a place that we would love to be, for the future, for our future generation, you know. Let us make the future proud of us, this generation. Okay. Yeah. Today is the 3rd of April, 2020. I am very excited that I am in good health. I have not caught the coronavirus, as I always take precautious or preventive measures. Okay. Uh, Trying to protect myself from catching coronavirus. So I do have a mask. All right, so I wear my mask whenever I go out. I still work. I am still working, so I'm always protecting myself. Yeah, so um, looks like the my case is dropped out, but yeah, I'll be here when you come through again. So yeah, a beautiful sunny day here in Melbourne, Australia. Yesterday was quite rainy, but today is sunny. A bit windy today, but nice temperature today. I think 23 degrees today. Really nice. All right, so uh, the coronavirus, COVID-19, has taken the world over. Okay, it's a pandemic, and whenever you turn on your TV uh, for the past couple of months, whenever you turn on your TV, since the first case was, recorded in Australia, um, it's all over the news. Okay, it's all over the news. So I suppose nobody is in the dark when it comes to COVID-19. Okay, we are all very well informed, uh, but but the world was totally not prepared for this new pandemic. Okay, so there are limited supply of testing equipment for this virus, but um, this virus or illness has symptoms like every other illness. Okay, have symptoms. It's not like your average flu, even though you have similar symptoms. Okay, but it's completely different. All right. I want to say thank you all for joining me. We currently 706 subscribers, so thank you all for subscribing to Chief Jonas' channel and helping the channel grow. I want to present to you a news article that I came across a couple of days ago, that everyone is looking for answers still. Okay, concerning the COVID-19, and everyone's been told to stay at home. If you have symptoms of coronavirus, you stay home unless you're dying. Then you can call the ambulance to come and pick you up. Okay, it's not good enough. Okay, it's not good enough. Simple symptoms like coughing and stuff like that, you can treat yourself. Okay, before the virus spreads and take hold of yourself. So if you find yourself coughing, if you find yourself having shortness of breath or breathing problems, put some camphor oil or some eucalyptus oil in hot water, in a bucket of hot water. Cover yourself with a towel and inhale the steam. Okay, inhale the steam. Okay, it's gonna kill every bacteria in your respiratory system. Okay, my grandmother told me this. Okay, hot water treatment. Okay, so whenever I have a cold or a flu, I just put a bit of rub or something, or camphor oil or eucalyptus oil in or even Vicks in a bucket of hot water and just inhale it. Just inhale it. All right, so I'm not gonna stay here for too long. Depending on who or how many people I have here, I will open the line. Okay, I will open the floor. You can jump in and chime in and help the conversation. Subscribe and share this. Okay. I do have this article from 7 News. Okay, in Australia. Okay, and I want you. Let me share the screen. Okay, I would like to share the screen. Share the screen. So this is, I think, symptoms of coronavirus. Okay.
But what do you look out for? The most common symptoms are fever, cough, shortness of breath and fatigue. Now, most people infected with coronavirus will only have mild symptoms. Some won't know they've had it at all. But what do you look out for? The most common symptoms are fever, cough, shortness of breath and fatigue. Doctors say a patient might also complain of chills, headaches or a sore throat. Less than 5% of cases involve the blocked nose. Severe cases can take 5 to 10 days to develop. For some people, as the body fights the virus, inflammation starts in the lungs. Breathing becomes very difficult. CT scans from a 77-year-old man with COVID-19 in China show how the lungs' ability to pump oxygen was reduced as the virus took over. In rare cases, the virus can travel in the bloodstream to other parts of the body, including the kidneys, intestines, and even the central nervous system and brain. The falling blood pressure and oxygen levels can put pressure on organs such as the heart, or in a patient can go into septic shock. But this is very rare. It happens in just 6% of cases. Here's Nat.
Well, for more, I'm joined by Sunrise GP Dr. Ginny Mansberg. Good morning.
Hello.
Could you break down some of the symptoms? What is the difference between COVID-19 and the flu?
And it's hard because they often were coexisting in China. But what we think is the stuff like the cold type symptoms, your sore throat and runny nose, is less a feature of COVID. Same with the aches and pains. It's really that dry cough and a fever. But as you just saw from the graphic, not everybody gets a fever. Not everybody gets a cough. And there are some people who have zero symptoms at all. So that makes it really difficult.
So what about the people most at risk? Are they the same for both?
No. So we definitely know with flu that it is the people over 65, the same. People with comorbid conditions, so other chronic diseases, but particularly asthma. Here it's not so much the asthmatics, it's people with high blood pressure, for example, and diabetics, and that's less expected. Like high blood pressure is not a feature of a worrying flu. We're really worried about pregnant women in flu. They don't seem to be at particular risk from COVID. And I think it's the little kids who are the super spreaders, the turbochargers of any flu season. Kids don't seem to really get any symptoms at all. And what we don't know is, does that mean that every kid has it and they're still spreading it? Well, they're not spreading it so much because they don't have a lot of symptoms. That research is still ongoing, but it doesn't look like kids are turbocharging COVID the way they do flu.
Okay, so I think there's a lot of confusion out there.
Yeah.
If you get cold-like symptoms, what do you do?
So I think you've got to self-check. Do I know anybody who's, had coronavirus? One of my friends was at a party. Somebody told me, you've been exposed to it. That's number one. Number two, have you come from a country that's just had a massive amount of coronavirus there? Iran, Italy, have you just come back recently? Then you would put a phone call through straight. I think the first person to call is your GP. I know our receptionists are basically medical professors at the moment. They're fielding so many calls.
Don't go in.
Don't go in because you go in, there are vulnerable people in there in the waiting room, and we don't want them to get sick from you coming in there.
Right.
All right, so you heard it from the Channel 7 crew there from Australia. Let's see. Where is this? All right, so this news article says what? Coronavirus symptoms. Okay, digestive problems, diarrhea, key indication of COVID-19. Okay, so I'm going to break this down. Okay, I'm going to break this down. I'm going to read it, and so you guys can be informed. Okay, be informed as you're home These are the symptoms you should look out for. All right, regarding COVID-19. All right, so Hajimeru. Okay, let's start. Let's begin. All right, so as the doctors learn more about COVID-19, there's let me put my mic in. I sound better with the mic in. All right. Okay. All right, so the mic is in. I'll take that again. Okay. As doctors learn more about COVID-19, there is new evidence an upset stomach can be a key symptom for people who have mild form of the disease. Okay. Digestive problems, particularly diarrhea, can be the first clue in a unique subgroup of patients who are infected with the new coronavirus but don't have the more well-known warning signs, according to a new study made available before peer review by the American Journal of Gastroenterology Monday. Okay, so yeah, the link to this article is in the description box. You can check it out after the stream. Okay, and this article was by A. Pawlowski, NBC News, on Wednesday, 1st of April. So April Fool's Day. So this is no April Fool's Day prank here, but this is real news. Okay, this is real. Okay, so these people may only later or never go on to develop respiratory issues and fever. They're also diagnosed later than other patients, which means they may unknowingly spread the virus. Okay, the findings come after previous research found up to half of COVID-19 patients in general may complain of digestive symptoms. Okay, so this goes to tell you, that this COVID-19 is an issue concerning hygiene. Okay, personal hygiene. Yesterday I was on live telling you that you need to observe strict personal hygiene. Okay, wash your hands before you eat. Wear a mask when you're in public places, especially closed environments. Okay, like rooms, cars, buses, whatnot. Okay, airplanes. Closed environments. Okay, wear a mask. Okay, observe social distancing. Okay, at least 1.5 meters. Okay, from somebody at least. Okay, keep them as far away as possible from you. Okay, or wear a mask. Okay, so to stop these vapor. Okay, what vapor droplets from splashing your face and stuff like that. And wash your hands. Okay, don't let people touch your personal belongings. Okay, like your phones and stuff like that. Okay, and disinfect your phones, disinfect your car steering wheels, anything. Okay, anything that you touch with your hand. Okay, above all, okay, before when you come back home, when you go out and come back home, wash your hands. Okay, before you eat, make sure you wash your hands. All right, it's very, very, very important. Okay, so this virus is spread through contact only, mainly through contact. All right, the cases which involve it being in the air is the case of the water vapor, or what's it called, vapor droplets from people's mouths when they speak to you. So if you're in close proximity with people talking who are infected with the virus, the virus affects people differently, and it depends on your immune system as well. So if you're a healthy person, okay, a very, very healthy person, all you may have is a diarrhea, okay, and you're fine. But if you have underlying health conditions, it's not gonna be a happy ending for you at all. Okay, so people who show severe symptoms of COVID-19 already have health problems. Okay, but majority of people recover very, very, very quickly, and whilst people are recovering, they're still capable of spreading the disease to vulnerable people like the elderly and stuff like that. All right, so I'm going to go on with the article. Okay, it's very, 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 very important that you maintain good hygiene. Okay, Okay, so these people may only later or never go on to develop respiratory issues and fever. They're also diagnosed later than other patients, which means they may unknowingly spread the virus. Okay, the findings come after previous research found up to half of COVID-19 patients in general may complain of digestive symptoms. Okay, so yeah. So they're doing a research here, right? Again, the article will be in the description box, so you can check it out. The authors of the new paper wanted to understand more about the 80% of people who have the mild form of the disease, said Dr. Brennan Spiegel, study co-author and director of health services research at Cedars Sinai Health Systems in Los Angeles. Okay, COVID-19 is not just a cough, Spiegel told Today. Of course, we're very focused on the lungs because that's what causes people to die. But this virus, if it gets into your saliva and you swallow it, can then enter your intestinal system. Okay, so this here, boom, don't go and be kissing strangers. Okay, don't kiss strangers. Okay, wash your hands before you eat. Okay, so I stated yesterday that about 90%, more than 90% of things that make us sick come out of us. I mean, outside of us. Okay, they are ingested. They are put into our bodies. Okay, the body can naturally fight off every, pathogen that exists on this planet. The body can naturally fight it. Okay, so I mean, try not to put things into your body that will cause you harm. Okay, be careful of what you put into your mouth. Make sure food is consumed hot. Okay, make sure your foods are consumed hot. Okay, so it's simple things. Okay, it's common sense. All right, so the virus enters the human body through a particular receptor that's found in very high levels in the gastrointestinal tract, he noted. So basically, it's your esophagus, okay, your food tract. So down your mouth all the way into your intestine, okay. If you unfurl your intestines, you have almost a tennis court worth of surface area. So you have this huge area where the virus can just start to replicate itself over and over again, Spiegel said. The study involved 206 patients with mild cases of lab-confirmed COVID-19 in Wuhan, China, where the outbreak began. Okay, so this is my thumbnail now. Okay, so transmission electron microscope image of an isolate from the first US case of COVID-19. Credit Gatto via Getty Images. Okay, so they were divided into three groups: 48 patients who only experienced a digestive system, okay, and 69 of them who had both digestive and respiratory issues, and 89 of them who only experienced respiratory symptoms. The authors followed them until they tested negative for the disease. Okay, so that's good. Of those suffering stomach problems, 57% had diarrhea. Okay, with 1/5 of those patients experiencing it as their first COVID-19 symptoms. Okay, so some people have. Okay, so some people have 57% of people who tested positive to COVID-19 had diarrhea. 57%. Okay, and 1/5 of these people, okay, only had diarrhea, a symptom of COVID-19. So this discovery is really, really huge. Okay, so about 62% of patients with digestive symptom had a fever at the same time, which left more than 1/3 of patients who continue to have normal temperature. So usually when you have diarrhea, you're gonna have temperature as well to go with it. So they go hand in hand. Okay, pneumonia. It seems that's happening in some patients who have the GI version of the disease, GI gastrointestinal version of this disease. Okay, so the findings mean that people who suddenly complain of diarrhea, nausea, or vomiting after being around someone possibly infected with the new coronavirus should be suspected for the illness, even if they don't have a cough, shortness of breath, sore throat, or fever, the authors wrote. Okay. What to know if you have digestive problems now. Okay. So diarrhea is one of the most common symptoms people experience in everyday life. Moreover, stress and anxiety, both of which are at high levels during the coronavirus outbreak, can cause GI symptoms like abdominal pain, bloating, discomfort, and diarrhea. So Spiegel advised people to consider the whole picture. Okay, I don't want people to panic and think, oh my God, I had some loose stools, so I have COVID-19. Well, probably not, he said. I would say this: if you have new onset diarrhea, you've not had it before, and now all of a sudden you have new diarrhea and you have a fever, that should be something that causes you to contact your doctor anyway, whether we're in a pandemic or not. Okay, but be careful not to go to your GP, because you might not have the COVID-19, but you show up anyway. Okay, and you do not have COVID-19, you might catch it there. All right, so you have to be very, very, very careful. Okay, so additional symptoms like nausea and vomiting, cough, and shortness of breath should be concerning too. So here, can the virus be transmitted through feces? Okay, and this is one disgusting part of it. Okay, can the virus be transmitted through feces? Okay, or your stools, or your poop, or toilet? Okay, the study didn't directly confirm that the virus is being found in stools of patients. We don't yet know 100% that these particles being shed are infectious, but we also don't have reason to doubt it at this point, Spiegel said. That's more reason to regularly wipe down the toilet handle, seat, and bowl, and wash your hands after using the bathroom, especially when you use public bathrooms or bathrooms in your workplaces. Don't touch the flushing unit. Don't touch it with your bare hand. Grab a piece of toilet paper and use it to flush it. Okay. Wipe down the toilet seat before you sit on it. Okay, and wash your hands. Okay, at least 20 seconds, and do it twice. 40 seconds. Okay, it doesn't cost you anything. Okay, all right, to wash your hands. All right, it will cost your life and the life of your friends and your colleagues if you don't wash your hands. And it's common practice amongst men. I've seen it being in a men's bathroom. Okay, people just do their business and walk out without washing their hands. And it is very, very disgusting. Okay, it is very, very disgusting. All right. So finishing this article, in a concerning finding, some COVID-19 patients were considered recovered because the virus was no longer found in their sputum. Okay, so sputum, mix of saliva and mucus, but still tested positive for the pathogen when their stool was checked, Spiegel noted. So right now, stool is not being routinely tested. The most rigorous definition of viral clearance would be it's not coming out of any of your body parts, he said. Okay, so this is tagged health and well-being, coronavirus, public health. All right, so boom. So that article is T. Kelly. Thank you for joining the stream. Sorry, I was reading this article. Ready to wake up from this nightmare. Right. Well, I think you should go back to sleep, sister, because this nightmare is going to last a very, very long time. Likely, you guys in the US will be having summer very, very soon. But we in the Southern Hemisphere, we're now going into winter. So it's going to be very, very, this virus, if it's not controlled, it's going to circulate, because the Southern Hemisphere, like in Australia, okay, we go into winter in June, okay, and the weather is already cooling down. Last night was, I think it was like 9 degrees Celsius, and people have started having cold and flus, and the flu shots are going to be out this month. Okay, on the 19th, okay, there's going to be flu shots out at the GPs, but our workplace, nobody's sick at the moment, so I'm going to take advantage of that and take the flu shot. Okay, so don't believe the conspirators and the all the conspiracies on the internet about vaccines. Okay, vaccines save life. I've always vaccinated myself, and I haven't died yet. Okay, I haven't died yet. Okay, so all these anti-vaxxers, okay, you're all very, very crazy. Okay, you're all very, very crazy. The only time you have a health problem, okay, concerning vaccine is when you already having health problems. All right. So some people have allergies and stuff. Like my mom is slightly darker than I am, but when she got an injection for something, she was testing for kidney problems, and thankfully she didn't have any kidney problems, but she had to take an injection anyway because of her blood pressure was a little bit higher. And a few days after she took the injection, her whole arm went numb, and her arm, where she got the injection, went totally black. All right, totally black. So she said she was not going to take any injection anymore. She got really, really scared. But I mean, she was obviously allergic to whatever was in the vaccine. But some people show, some allergic reactions, but it doesn't mean the vaccines are bad for you. Actually, vaccines are really, really good for you, and you need to protect yourself. All right. So the nightmare has just begun. Okay. This is going to be around for a very, very, very long time. Okay. As the northern hemisphere is getting to summer, we all know that COVID-19 can withstand heat. Okay. So the southern hemisphere is going to incubate it. Okay. If countries like Australia, Brazil, Argentina, Chile, South Africa, New Zealand, if they do not take this very, very seriously, it will just be circulating around the globe for years to come. Okay, many, many years to come, unless they find a vaccine for this problem. All right, so boom, I'm looking at Africa Watch now. Okay, so Africa Watch now, we're looking at africanews.com. Okay, one of my favorite go-to sources for information on the continent of Africa. So we do have here 12 hours ago, Malawi. For a very long time, Malawi did not have COVID-19. Okay, any reports of COVID-19, but now COVID-19. What was this? Somewhere I saw the 3 cases now in Malawi. Okay, so Malawi is now the 50th African country to report of COVID-19 infection. Again, we look at Tunisia as well. Tunisia puts first woman doctor to Hida Ben Sheikh on the new banknotes. Okay, so this is awesome for Africa. Okay, particularly the Muslim countries. Okay, honoring women now and promoting female empowerment. Okay, this is what we need. All right, this is what we need: equality for all, male and female. Right. Boom, and of course that's the African norm. Okay, equality for all. Okay, that's the African norm. Right. Boom. So I read that one yesterday. Botswana's president tests negative ends coronavirus quarantine. Somalia's giant economic strides. Okay, so I'll talk about those things in the near future. But this topic is concerning coronavirus, and I want to bring to you the awareness and stuff like that. So hope you are all very, very aware of this. Okay, again, I stress. Okay, wear a mask when you're in public places. Okay, wash your hands. Okay, wash your hands several times, as many times as possible. Okay, so Sierra Leone announces 3-day national lockdown. Doctors push for 14 days. Okay, so everywhere else is 14 days or indefinitely. But why 3 days? It's crazy. Okay, 3 days is just so crazy. So yeah. So what else is here? Africa Watch. We're looking at business. Zimbabwe reintroduces US dollar. Okay, into Africa. Panic buying disrupts food market in Africa. coronavirus, Tigray first to get regional testing center across Ethiopia. So Tigray, I think Tigray is the biggest, the most populated in Ethiopia. No, am I right? No, I think it's Oromia. I think it's Oromia. So that's very interesting, right? We know Abiy Ahmed comes from Oromia. Okay, so 20 killed in Congo Brazzaville as lightning triggers electrocution. So this is third world problems. Okay, third world problems. Okay, so coronavirus, African Development Bank approves $2 million package for World Health Organization Africa's response. Okay, so Ghana, I think Ghana. I'll get to that, but Ghana has approved World Bank's grant of, I think, $2 billion to tackle coronavirus. So I'll look at that as well. COVID-19 whips, nah, that's not concerning Africa. So African governments using a similar COVID-19 containment rule book. Okay, so this is really good. So I'm very happy that Africans are coordinated with this coronavirus pandemic issue. So Kenya secures $50 million coronavirus loan from World Bank. Cases hit 110. So yeah, that's pretty cool. Okay. APO coronavirus, Burkina Faso crisis coronavirus. COVID-19 concerns highlight pressure on Sahel food security. So we all know how the coronavirus got to the Sahel region because of the bloody French. Okay, the bloody French are always in the Sahel. Okay, they're in the Sahel, and they brought coronavirus to Africa. Okay, they brought it to Africa, and they must be held accountable. Okay, for this. All right. Niger also 10 new confirmed cases of COVID-19 recorded in Nigeria. Okay. Yeah. So we know how the coronavirus got into the Sahel region. Okay, and it came from the bloody French. All right, bloody French. So T. Kelly says it's close to midnight in California. I have work in the morning. Glad you're doing very well there. Thank you, sister. Thank you for coming through and supporting the channel. I really appreciate you. All right. Boom. Enjoy your sleep, and I hope you enjoy work tomorrow. When you go to work, make sure you wear your mask, keep your social distance from people, and take care. All right. Peace, family. Peace. Peace. So yeah, moving on. Moving on to Ghana Web. Okay. So Ghana has stepped up its border security and arresting people that evade border measures. Okay. So they're arresting people, and also, where did I find that news? So also there have been cases where people have contracted the coronavirus through sex workers. Okay, so you have to be very careful now. Strictly observe the social distancing, regulations that have been put out by your government. Okay, this is not the time to be going to brothels. This is not the time to be seeing girlfriends and going on dates. Okay, because you don't know who has the coronavirus. Okay, and can give it to you. So this is gonna really change the way we live our lives. Okay, in the coming future. So yeah, my policy is you can't touch me. Okay, don't touch anything that belongs to me. Okay, all right. This is it, as simple as this. Okay, and don't come into my personal space. Be 1.5 meters away from me. All right. This is going to be the norm moving forward. Okay. Your health always comes first. Okay. Your health and safety always comes first. All right. I'm looking at a topic here. Parliament passes COVID-19 National Trust Fund Bill 2020 from Ghana. I think the bill included the donation, not know if it's donation, the World Bank gave. Okay, so what happened to the article? The article is not found. So I'll have to do better research on that and find the article. But the news topic says minority urges government to disclose source of $65 million, $65 million for coronavirus. Okay, so this is really necessary so that people do not pocket that money. Okay, so the government has released $65 okay, to fight coronavirus in Ghana. Okay, and opposition groups are demanding receipt, okay, and proof of the money so that people do not squander the money. Okay, all right. These are the times that Africans must be frugal with their money. All right, not throw money away and embezzle the money. Okay, these politicians, I wonder where they're going to run to now. Okay, Europe is highly infected with coronavirus. They cannot run to Europe anymore. I hope Paul Biya, is it Paul Biya or Joseph Biya or whatever his name is, the president of Cameroon, who is already 80 years old, Museveni, Museveni, okay, if you're listening to me, okay, I hope you stay put, okay. You stay put and you come out of this really strong. Okay, this is gonna really test you, mister. Right, so yeah, trouble is brewing for African presidents who are all over 60 years old. Okay, trouble is brewing for them, apart from Abiy Ahmed. Okay, trouble is brewing for all of them. The Ghanaian president, I think he's like 72 years old. Okay, trouble is brewing for all of them. Okay, so yeah, take care of yourselves. Okay. And my thing is, all these old, leaders in Africa just need to go. All right, just need to go. All right, we need a new dawn in Africa, with young and vibrant African leaders. Okay, to spearhead, progress and development in Africa. Okay, moving forward. So yeah, boom. I am going to end this stream. Okay, I want to say thank you all for joining me. Take heed to all your instructions. Okay, obey the lockdown regulations. Okay, stay home. Okay, stay home, protect your family, protect yourself. Okay, wear a mask. Okay, wear a mask when you're in public. Okay, wear a mask when you're in public places. Okay, always have it in your pocket. Have a mask in your pocket always, that you can protect yourself. All right, stand 1.5 meters from people. Okay, and don't let people get in your personal space. Don't give people your personal belongings like your phone and stuff like that. Keep anything that belongs to you. Keep it to yourself. Okay, don't shake people's hands. Okay, wash your hands frequently, as many times as possible. Wash your hands. All right, before you eat anything, make sure you wash your hand. Preferably eat with spoons. Okay, eat with spoons. Okay, don't eat with your hands. All right, stop the spread of COVID-19. Okay, and it starts with you. Okay, it starts with oneself. Okay, so yeah, this is what it is. COVID-19 is a hygiene problem. Okay, it's a personal hygiene problem. Okay, from my deduction. Okay, so take care of yourselves. Observe strict personal hygiene routines, and look after yourself. Okay, basically look after yourself. All right, family. Take care of yourselves. Look after yourselves. And until next time. Okay, Chief John is signing out. All right, peace to everyone. Peace. Stay well.